What's up, YouTube? Dr. Coughlin here at Freedom Chiropractic in Mount Laurel, New Jersey. I want to go over with you three types of headaches and migraines that chiropractic care can help. Now, I want to be clear that the right kind of chiropractic care is super important here. So I'm going to go over that at the end. But first, I just want to go over the different types of headaches. First and foremost, number one is going to be what's called a cervicogenic headache. All right, that's going to be a headache that basically means it originates with a neck problem. You're going to typically have neck pain that becomes a headache in a cervicogenic headache. All right, chiropractic care has been shown to be highly, highly effective for cervicogenic headaches. The second type of headache is something called a tension headache. All right, tension headaches are typically going to come from a lot of tension in the neck, shoulders, upper back. It's also going to come when we have a posture where our head comes forward and our shoulders round forward. This creates a lot of muscle tension that's constantly pulling back here. People describe tension headaches almost like having a ring around your head. Again, chiropractic care has been shown to be highly effective for tension headaches. The third type of headache I want to talk about are going to be your classic migraines. Again, migraines have been shown to respond very, very well to chiropractic care. And again, migraines are typically going to kind of hang out on one side. They can affect your vision. They can be debilitating for a lot of people. So rather than relying on Tylenol and Advil and Excedrin and prescriptions like Imitrex, I'm going to go over with you some more natural, hands-on techniques that we can utilize to help not only reduce the frequency and severity of your headaches, but really just, ideally get rid of them altogether. So I want to share two research articles with you that are actually analysis articles, meaning that they look at a bunch of other articles, just to go over the evidence-backed guidelines that we're looking at. So first article I want to share with you is from the Journal of Manipulative and Physiologic Therapeutics. This was published in 2011, so this has been around for a long time. Evidence-based guidelines for the chiropractic treatment of adults with headache. All right, they looked at all three different types of headaches in this study, and they actually looked at 21 different articles. And in the conclusion of this study, they said evidence suggests that chiropractic care, including spinal manipulation or spinal adjustments, improves migraine and cervicogenic headaches. Again, this is in over 21 different articles that they were looking at. Another meta-analysis or review article where they look at a bunch of other research studies. This is in a journal called Headache, the impact of spinal manipulation or spinal adjustments on migraine pain and disability, a systematic review and meta-analysis. Again, in this study, what they did was they looked at 6 different studies, 677 people involved in this study, and they followed them from 2 to 6 months. All right, and what they found overall was spinal manipulation, or again, chiropractic adjustments, reduced migraine days as well as migraine pain and intensity. So they didn't find that they got rid of the migraines altogether, but they reduced the frequency, duration, and the severity of the migraines that the patients were suffering with. So again, it's well documented that too much Tylenol is going to damage your liver and kidneys. Too much ibuprofen, which is Motrin and Advil, is going to destroy the lining of your stomach and also your gut, which is also called your small intestine. It causes leaky gut syndrome, which can cause a whole nother host of symptoms. And then lastly, things like Excedrin can be really high in caffeine. And then forget, obviously you get into the end of the migraine prescription drugs like Imitrex, and there's a number of other ones. Again, you're looking at side effects, you're looking at high expense, and it's just not good for your body overall. So I'm going to show you what to look for when you're evaluating possible chiropractors that you might seek and what they're doing to analyze your spine and make sure you get the best results. Number one, if they're not getting any imaging at all, I wouldn't be using them. Reason being, they're not going to be specific in knowing exactly what's going on with your case. So I'm going to show you exactly what that looks like in this next video. All right, so picking up where we left off here, and forgive me, I'm actually filming a screen of an x-ray here, but I want to show you what to look for when you're pursuing a chiropractor as far as if you're suffering with, again, cervicogenic headaches, tension headaches, or migraine headaches. And I know there's different types of migraines and all of that, but if you're searching for a good chiropractor that can properly analyze your spine and adjust your spine to help you get relief from these headaches, I just want to show you what to look for. All right, so you're going to see, I'm going to show you when we evaluate the upper neck, okay, that's going to be our most concerned area, is what we call the upper cervical area of the spine. So it's going to be basically the base of the skull, which is also called the occiput. There's going to be a bone called C1, which is also called our atlas, which is a very top bone in the neck there, and then C2. All right, so if you see with my mouse, I'm going to show you. What we're looking at right here is the bone C1. So C1 sits on top of C2, and this bone right here is C2, okay? And in this patient's case, you're going to see C2 is rotated. C1 is also favoring one side. And you can see we get this x-ray by having the patient open their mouth, and that allows us to see past their teeth at C1 and C2. So a good chiropractor is going to analyze the upper cervical spine. Again, the base of the skull or the occiput, C1 and C2, okay? This is one view that we take, all right? This is called an AP open mouth x-ray. The other x-ray I'm going to show you here, or another x-ray I'm going to show you here, is what we call a base posterior x-ray. All right, so again, we're looking at this patient from behind. They're looking up at the ceiling, and we are analyzing C1, which is this circular bone right here, and we're actually measuring if there's rotation or one side shifted, meaning that the C1 bone either shifted to the left and rotated or to the right and rotated. Again, with this specificity, it allows us to provide the best quality adjustments because, again, we want to unlock stuck bones. Like chiropractors are really good at unlocking joints that are stuck. But when we do it, we want to do it with intentionality, that we're actually moving it towards the direction that it should be, meaning that the body has a overall homeostasis position that it wants to be in. And so when we're unlocking these joints, we do want to gently guide them back into a proper position. Again, so this is the second x-ray that we take, called a base posterior film. And then the third view that you're going to see here, this is what's called a lateral cervical. All right, so again, what we're looking at here is the base of the skull right here. We're looking at C1, which is this top bone, and then we're looking at C2. That's the primary, what's called upper cervical spine, that we're analyzing for why this person's dealing with headaches or migraines. And so again, we can be real specific with our analysis so that when we adjust this person, we actually have a three-dimensional view. And if you remember three-dimensional, we're looking at the side here. We looked at it from underneath, and then we also looked at it straight away. So again, three-dimensional view. In many cases, we'll also follow up that lateral view with what we call flexion extension. And you can see this woman here is looking downwards. That's what we call cervical flexion. And again, what I'm doing here is I'm analyzing the movement in C1, and then we can also do what we call an extension film, where we're looking at the movement there. We'll also take into account the movement of the other bones in the cervical spine there. Some people deal with headaches because their spine has become unstable. And so that's another thing that we need to analyze and account for. Again, these are all areas that you want to look for a chiropractor providing really specific, what's called upper cervical chiropractic care. And that's going to allow them to properly analyze your spine, help you get the results that you're looking for, and help you avoid things like, again, the Excedrins, the Advils, the Tylenols, the prescription drugs like Imitrex. These things are short-term and they're not good for you. We want to make sure that we're looking for a long-term correction of that spine so you get the best results, you can feel your best, and minimize any need for medicine. Again, this has been Dr. Coughlin at Freedom Chiropractic in Mount Laurel, New Jersey. You can check us out on our social media, also freedomchiropracticnj.com.